to produce these telecasts to inform, educate, and comfort our communities. A reminder that if you are watching live on Facebook, you should be able to leave a comment in the comment bar on the CAT TV channel. And we have two great guests today. So if you have questions about the pandemic, COVID, vaccines, your local hospital and health department rollouts, please leave some questions. We have a bunch for the guests as well today, but we will try to get to your questions as well. With the help of CAT TV, this session, along with others, will be recorded, replayed on CAT TV often, as well as hosted on various websites and social media. So, we're doing our best here to communicate with the communities that make up Southwestern Vermont and surrounding states as well. At this point in mid-January, America is on the cusp of 400,000 deaths due to COVID-19 virus. I thought it would be interesting as we kick off this telecast to think about that in context of war. The single greatest amount of death this nation has ever seen in war is from the Civil War. Collectively, both North and South took over 620,000 American lives. Following World War II comes in at 300,000 American deaths. World War I saw 117,000 American deaths. The Vietnam War saw 47,000 American deaths, while the American Revolution saw a mere 24,000 deaths. Both the Iraq War and war in Afghanistan that we're currently in have only seen 5,669 American deaths. COVID-19 deaths, again, 400,000, is only behind the Civil War in amount of American deaths. It is a stark reminder of the true enemy we face today. It does not care about red states or blue states, the color of your skin, the religion you practice, whether you're wealthy or poor. It wreaks havoc on families, friends, and foes alike. However, today there is hope. A vaccine that administered twice, 2 weeks apart from one another, can save countless lives. Today we want to discuss where we're at in Vermont and Bennington County with the ability and availability to administer this life-saving vaccine for our citizens. So today, joining us from Southwestern Vermont Medical Center's Chief Medical Officer, Dr. Trey Dobson. He's joined us all through last year and continues to join us this year. And a new face, and we love to welcome Megan Harrington from Bennington's Public Health Services District Director for the Vermont Department of Health. So welcome, both of you. Thank you for joining us today. Dr. Dobson, I want to start with you. Right before we went live, we said, we should probably give an update on the vaccine, why the vaccine is so crucial. Hopefully the opening segment gives a little stark contrast to where we're at as a nation. But give us an overview of what this vaccine is, how it works, and why it's so important. And along with that, other mitigation efforts that will help.
Sure. So Matt, you did start us off with a very realistic and somber note there. I'll add one more number. That's 650,000. That's the number of U.S. lives lost in 1918 from the last pandemic that we experienced. So unfortunately, we're certainly going to eclipse that number. The vaccine is the way out of this, Matt. We've talked about this before, but it's becoming more and more apparent. We're lucky. These vaccines are incredibly effective. They're incredibly safe. But we cannot get out of this situation without them, or else we'll linger for years trying to achieve some type of herd immunity, and we'll lose millions of lives. It's become more and more apparent. It's actually what we thought would occur in October and a little bit earlier, as we saw the vaccines starting to come through and be developed. We again had great news that how effective they are and how safe they are. But now we have to get them in the arms of individuals. We have to get them vaccinated. You mentioned this about the deaths. So let me just kind of highlight what the state, what Megan's team, and what we're focused on. And that is, we can save lots of lives initially if we can get the older population vaccinated. Those are the folks that end up having death and having lots of hospitalizations. And then we can move from that point. That'll improve the resources in the hospitals and the healthcare system, the doctor's offices, the health departments, and we can move at that point to get the younger population vaccinated. And the benefits there are reduced sickness, opening up of businesses and schools, And I still am very optimistic on this, despite all the problems that we've had with this rollout nationally, that Vermont is doing a good job. As we're going to talk about, Megan and I, we're constrained by supply. But if we stick on this roll, we can get 75% of the population vaccinated by this summer. It'll be amazing how travel will return, how social gatherings will return, how emotional well-being will return. But it's going to require everyone moving through the vaccination process. Not, if half the population does it, we're just not going to get there.
So tell us, Dr. Dobbs, so what phase are we in now?
We're in phase 1A, and these phases come out of federal CDC type recommendations, actually a committee to the CDC, and they're guidelines, and they're idealistic. They're not operationally reasonable, and that's why each state is taking its own population and molding these phases. Vermont has taken the approach of one phase, that's phase 1A, and then the rest of it being done by age bands. And this eliminates all of the operational hurdles that we've already seen, even among healthcare workers, when we try to prioritize. It makes sense, it's ideal, but we cannot get through enough of a population with these priority measures. So let's just throw them out. Let's go by ages. Let's get as many people vaccinated this spring as we can. Unfortunately, we're running into the supply constraints that we knew would happen. It's going to take another month, maybe even 6 to 8 weeks to get that supply up, barring any unforeseen problems with manufacturing and distribution that will occur. I just want people, and Megan and I were talking about this earlier, we want people to understand that the next 6 weeks is going to be slow, and you may not have that opportunity to be vaccinated, even when your age band is called right away. But as soon as we get that supply in, whether that's SVMC, whether that's the state, whether that's the health departments, pharmacies, as soon as we get that supply in, we're ready to go with it.
Great. Megan, talk to us a little bit about age bands. Kind of when will that vaccination start? I know there was some news articles floating around this weekend around, getting to that 75 and above, and then eventually working our way to 65 and above. Talk to us a little bit about the age bands there.
Absolutely. And I really think, this was the announcement people were so excited to hear, when we were going to move from 1A to to the age band phase. And so the announcement came out earlier this week that starting January 25th, registration will open. Sites will be announced, appointment slots will be made available, and clinics will get started January 27th and move forward from there. Again, we cannot stress enough that availability of appointment slots will be based on our vaccine supply. So while all these great systems are being put in place, logistics, IT, communications, and PSAs, all of these efforts really rely so heavily on our vaccine supply. So we're looking at 75 plus to start out, initially starting January 27th, depending on, again, will sound like a broken record, our vaccine supply, general vaccine uptake, the number of people who are eligible, who are getting signed up for appointments and getting the vaccine, to determine when we go on to our 70 plus phase.
Okay. Both of you can probably answer this, but I know in telecasts past, we have told people to call their local doctor, physician, call the health department, talk about it with your physician about signing up or just your interest. It seems like that's changed a little bit. And so how are people able to sign up now, and when will that become more available? And obviously, like you said, Megan, a lot of PSAs and kind of communication channels will be broadcasting this, but what's the thought around signups here?
Yeah, so the plan is for a centralized appointment structure. Anyone who signed up for our testing clinics at the VDH website will be familiar with the platform that we used. You create an account with your demographic information. Once you're inside, you can select your appointment date. The same interface will be what we use for our vaccine appointments as well. There will be an online registration option as well as a call-in center. So a lot of work is being done to staff this call-in center. Last I heard, 200 people had been told to do the initial staffing. So folks will be able to access online and be able to make a phone call. That being said, call centers can get easily inundated. And so we're asking people to refer to the online system. We understand that this first age band, 75 plus, if any assistance is needed, we're really encouraging folks to have that conversation with your family members beforehand. Are they comfortable with that system and being able to access? And if online isn't an option, then the call center will be there.
Is there sense in having people watching this right now even go to the Vermont Department of Health website and start their just being able to get their username and password and that setup? Is that recommended to pre-vaccine registration?
Not quite yet. Setting up the account itself, I believe the 25th or a little bit before, we should start seeing both the URL for the registration system and that call-in number. There was, I actually was just listening to the press conference a little bit. There was some mention of items that people can have ready to help ease with the registration, some information you might need to help that registration process go easy. So we'll look for that information and try to share that out widely.
Okay. Dr. Dobson, anything to add to that as people sign up? And I know a lot of our questions today will kind of focus on how do we get the public acclimated and educated on how to do that best. But anything you want to add currently?
Sure. I mean, first off, Megan has that all dialed in. I would say, she mentioned the website, which is not ready yet to register, but it's actually an excellent website for resources. There, the Department of Health changed back in the fall towards sort of an FAQs approach, a question and answer portion of the website. It makes it really easy to navigate. And I will say 95% of the questions you may have are right there and easily explained. So I give them a lot of credit in that setup. Also, SVMC, we update our website on a daily basis, but certainly on occasion whenever new information comes out. And it's got great information too. We try to keep it concise and not overburdensome. We also welcome input for people that are trying to navigate the system. But to your point earlier too, which kind of dovetails here, calling the health system, calling Megan, calling me, there is no list to get on. And so it doesn't do any good whatsoever. Going through the website is the ideal way to do it. We're hopeful that it maintains itself and doesn't go down. I think everyone is aware of many instances of signups for anything from concerts to anything similar to this, of websites going down for a while. So that's possible. But if you can do it that way, if you can get a friend to help you, that is the best way to do it.
Great. I want to go to a couple Facebook questions right now that we have coming up. Husband is handicapped at 75, and I'm his caregiver at 74. So this is, can we get vaccinated at the same time?
Yeah, unfortunately, no, not right now. And I know that's disappointing. What that is a great example of someone who needs it with a compelling argument, but it requires prioritization that impedes our ability. And as soon as we allowed that, there's going to be the 69-year-old with the 75-year-old. And unfortunately, it just doesn't work towards the goal. And the goal is to vaccinate as many people as possible. By the way, think of it this way, Matt, vaccinating you actually helps protect me. So if you can't get vaccinated, you do want others to be vaccinated. And that's really important. But I feel for that individual. I understand that. I've had that question many times. I would say the good news is, assuming supply, Megan and I are going to keep saying that, the 75 plus age band should move pretty quickly. When I say that, I'll try to be a good realistic conservative and say it is possible to get through it within 3 weeks, maybe 4. And when we run the numbers here, it's even possible to do it faster than that. It just depends on operations. So that individual would be able to get vaccinated, pretty quickly, pretty shortly after her husband.
Okay. This one may go to Megan. You had mentioned that on January 25th, registration will open on the website. What time? And this comes from Facebook. So is there an actual time that it goes live?
I could speculate, but I am not sure. I'd hate to give false hopes, but I do know on the 25th, if not before.
Yeah.
And I imagine the health department and any news outlet is going to make that very clear that that is up and live. So.
Yep. Here's another challenging question for both of you, and I think I read something about it in the Bennington Banner over the weekend, but what about snowbirds who will have to quarantine for 2 weeks? Can they make appointments after the 25th for when they are back and negative?
Well, I'll start there, and Megan can add some of her knowledge. This information does change rapidly, and fortunately, Megan and I are in several of the same meetings, but also we have our own independent sources, so it's good to combine them here. There are 3 requirements to get vaccinated in Vermont, and the first is, and it can be either or of these. So you have to be either a Vermont resident, or you have to work in Vermont, or your primary care physician has to be a Vermont primary care physician. And the caveat on living in Vermont is it has to be greater than 6 months, or you have to have moved here with the intent on staying. So back to your question, Matt, the person I think the person asking that question says, yes, I know this, and I am a Vermont resident. I just happen to live, down south in the winter, and I'm not going to be there for a couple of weeks. We believe and we hope, and Megan and I were talking about this earlier, that there'll be the ability to sign up, for an appointment slot weeks out. Now, we don't know that. And so if that's not the case, we're going to try to recommend that and help try to improve the system. We believe it will be the case, maybe not right away, so that it is conceivable that on the 25th or 26th, whenever you log on, that you could select a date further out, like you can do, in other types of sign up. They may not allow that right now, and I want to defend them a little bit. It's not because they don't want to help that person. It's probably because they're concerned about supply.
Okay. There's a question, I think we get to it as well, around mobile distribution. So if I can't get to a hospital or a clinic, is there such things as visiting doctors or anything like that?
Yeah, a lot of effort is being made to address the needs of homebound residents. And so there is planning is in the works with home health aides, with EMS agencies, and time and again, for not just in the pandemic time, but transportation is one of the biggest barriers, to health access and other services, in not just Bennington County, but across the country. And so we want to be very cognizant of that challenge. And so a lot of work is being put into arrangements with EMS agencies and home health aides to identify folks.
I want to remind those watching on Facebook Live, please leave comments if you have questions. We're getting to as many as we can. This is always the great part of how we've transformed since COVID, is this ability to talk to the community. Looks like we have over 75 people watching right now, and that's terrific. We love the idea of spreading good information, but also questions on Facebook as well. So again, if you're watching on CAT TV or over at the Chamber page, please leave a question for Megan or Dr. Dobson. Is there a cost to the vaccine, or how exactly is this all being paid for? Dr. Dobson, why don't we start with you, and then Megan, if you have anything to add.
Sure. So there's not a cost to the individual. Of course, it does cost money to do this. And in fact, it costs a significant amount of money. Those monies are coming from federal and state levels, and insurance companies will be billed for that. But no one will be turned away. No one will have to pay a copay. This will all be done, by either the state or the local site, depending on how it evolves, to the insurance company. But this was mandated from a federal level, so there was no charge to the patient.
Question on Facebook. Can you sign up at 65 just in case you don't get a lot of 70-year-olds on the 25th?
My understanding is no, that there's going to be a hard stop on that. But let me just talk to that person's concern, because they're right on the money. If we don't get, for some reason, we will initially, but let's just say pretty quickly, the chairs don't fill, so to speak. We've encouraged the Department of Health at the state level, and they, of course, listen and understand that we need to move to that next age band quickly. So I hear people say when we're finished with one age band, we'll move to the next, and that's not the case. We are going to move as soon as we see capacity develop, and that's the only way that we're going to keep the clinics full. We need them to be full so that they're efficient. That's why large capacity clinics need to be present. If it's too spread out, it'll be too slow. Then once we get a good significant portion of the population, actually the reverse happens. It's important that smaller clinics are available in doctors' offices, at the Department of Health, in pharmacies. And I think we benefit from a strong state viewpoint, and also the fact that we have around this state lots of scientists, lots of physicians, lots of Department of Health people that have recognized this early. You're going to see some states are struggling because they're trying to prioritize too much, they're trying to spread out the clinics too much, and that's just not going to be as efficient.
Kim on Facebook, and Megan, maybe you can help with this question. Where will the vaccination clinics be held?
So we're looking at a couple sites in Bennington County specifically. Right now, VDH is working on a Manchester location. Details of that should come out soon. And Dr. Dobson, if you want to speak to SVHC.
Right, and also SVHC is applying to the state to be a vaccine site, either right on campus or adjacent to campus in an area where we can see lots of people quickly. And then to the point that I just said, and after those, then eventually some of the pharmacies and probably some other locations, certain medical practices. But that's unlikely to happen until supply gets really high. There's that supply thing again, as well as we get through a large population. Granted, it is just January, so we knew the supply thing would be problematic. I think before we know it, we'll have some rough few weeks, and then we'll have a smooth process where people the throughput's high, and they have a few choices of where they can go.
Yeah. We would love to see that as we get further into the spring, that our initial larger clinics that we're able to move into smaller communities around our district.
Okay, great. We've got some great questions coming in from Facebook. What about Massachusetts residents with doctors at cancer centers? How will they be prioritized?
You want me to try to answer that, Megan?
Yeah,
that's one of those. That's one of those questions that is not delineated in the FAQs, because otherwise it would get really, really long. In general, it's supposed to be with your primary care physician. I can tell you that if you don't have a primary care physician, if you have only an oncologist, that would certainly be honored. No one's going to turn that person away. What we can't have is people coming to get vaccinated here that really have no connection, because that's how the vaccine is allocated. I mean, if it was up to us, we would say, if you're from Hawaii, sure, come here, we'll vaccinate you, because that's the goal, that's the principle. Let's vaccinate as many people as possible. But it's not how the vaccine is allocated. So if we started doing that, then we would run the risk of people in this area not having opportunity for the vaccine.
Okay, this is another one maybe for you, Dr. Dobson, from Laura on Facebook. Will we be able to choose between Moderna or Pfizer vaccinations?
Right, not early on, not at this stage in the vaccine process, and there's many reasons for that, but it's primarily just operational efficiency and making sure that the vaccine is available. The way to choose, if someone is really steadfast on that, is to not receive the vaccine if it turns out to be the one that you don't want, and then you just sign up again later in the future. I would not encourage that. There may be some specific reason that this individual has, and I want to support that and honor that. But most of those concerns are not grounded in biologic plausibility and in science. And I think once people know that, they're open to receiving whichever vaccine is possible.
Dr. Dobson, always a good reminder of the science behind a lot of this stuff too.
Yeah, and if I could add a note to that, based on the information we're receiving about allocations is usually a pretty quick turnaround. We don't get a lot of heads up, and it might not necessarily be something that's made public through the registration site. People might not be told which one they would be receiving at which one. So I shouldn't speculate on that, but right, we might not have that information prior to someone signing up.
Okay. Debbie asks, people are saying that the second dose of vaccine will be worse than the first. Is it true? Also, what to expect? First dose in the arm was sore, next day tired. So Dr. Dobson, maybe you can start with the initial question, but maybe just walk us through what happened. What is actually getting the vaccine look like?
Sure. So let's see, walking you through, you go into the clinic area, you provide some information. Actually, we think a lot of that's going to be done online now, which will tremendously speed up the process and the efficiency. It's so straightforward. You roll up your sleeve, you get the needle in your arm, and then you're observed for 15 minutes, unless you have a history of severe allergic reactions, in which case you'll be observed at least 30 minutes, and then you're done. It is as straightforward as you see it on TV. Now, the question on the side effect profile for the second dose. So it was noted in the trials that the first dose side effects, which include arm soreness in a significant population, was the same as with the flu vaccine. And the same is true for developing a headache and fever. It's about 2% or less in that first vaccine. In the second one, though, in the booster, it's as high as 15%, where people will get a headache or a fever or muscle aches. So that's real, and we definitely want to be transparent about that and have people understand that. It lasts less than a day typically. The longest I've heard is someone who had intermittent fevers for 3 days. By the way, every time they took ibuprofen, it went away and they were able to go to work. So the most I've seen people be out for is a day, where they decided they were just so tired, they had some intermittent fevers and they remained at home. I mean, tell you, that is nothing compared to getting COVID-19. It's also nothing compared to spreading COVID-19 to a family member and causing severe harm. So it is more prevalent in younger folks. So in this first group of 75 and above, it'll be probably around 2%. But the younger folks tend to have that strong immune response. They see that second dose. Your body says, that's not right. We're going to attack that. It raises your temperature. You get some muscle aches. I have not heard of one person having, such difficulty that they were beyond 3 days or needed hospitalization or anything like that.
And following your first vaccine, you're actually provided with some information about the CDC's VSafe program, which is a platform that allows folks to almost give direct feedback to CDC about their experience following the vaccine. So any kind of, adverse, overly severe, reactions, we'll first, want to address those in the immediate, but you can report back, which is amazing public health firsthand information to be able to provide back following your vaccine. So that handout is provided to everybody. It's an app, and it actually provides reminders about second dose and other helpful tips about staying healthy. So it's a really cool CDC platform.
Great. Thanks, Megan. Another question from Jared on Facebook. I've been following the caseloads in Bennington County, and the 14-day trend has been increasing, and we're now up to an average of 18 cases per day. Can you shed any light on the increase in cases? Are these due to outbreaks? Are there parts of the county where we are seeing higher caseloads? And so maybe we'll start again with you, Dr. Dobson, but Megan also, feel free.
Sure. So going backwards there, it's hard to determine parts of the county because I agree that the numbers are increasing. They're still so low that you can't really develop trend there. That could just be chance. So I will say it is likely to be community spread now on the low end, which is good. And it is plateauing, as are hospitalizations. And we believe that's all due to Christmas vacation. We believe that this increase was predicted. Actually, the models show that the state will go up to around 300 cases per day based on what we're seeing, and that hospitalizations will follow that and hopefully level off. And actually, we're not the only place that's seeing that. There's some other places seeing that. The good news is we don't have any vacations coming up, and that allows a little bit more of a standardization here. We have to follow our mitigation. We have to continue to wear masks. We have to be spread out. We can't be gathering in homes until we get people vaccinated this spring. If we do that, we're going to be okay. If we don't do that, we're going to be overrun like many parts of the country.
Megan, anything to add to that?
Glad the holidays are over. Yeah.
I'm not sure. I don't think Valentine's Day will be as bad as the Christmas holiday. What's the next one we have to wait for? I think we're pretty far off. Here comes one through a text. Head of school wants to know if the health screeners at school can get a vaccine. So I'm assuming, there was a pivot away from some of the more phasing and then went to banned, but schools I know have been pretty vocal about either receiving vaccine or not receiving it. But specific to health screeners, any news there? Or are they gonna have to wait their turn like everybody else?
Unfortunately, I think they'd have to wait their turn. So the 1A was focused on folks with direct patient contacts, or those supporting direct patient contact. So a health screener at a school, without knowing the full extent of their rule, that wouldn't necessarily meet that definition. So they would have to wait for their appropriate age band.
Okay.
Matt, it's let me just add Megan's exactly right. This is really tough. Of course, we want that person to be vaccinated. They have to be facing right next to these kids who are running around asymptomatic and can spread it. The problem is almost everyone somehow meets this definition of having front-facing interactions with people. Not almost everyone, but greater than 60%. And we just do not have the vaccine supply. And then trying to figure out who those people are really inhibits operations. So we've just got to move forward with what we know. If you're older, you're at risk of dying. You're at risk of hospitalization. Let's get those folks, and then let's move down. But yes, it's a compelling argument. I feel for that person. I every day have at least 5 to 10 people call up and say, but you don't understand. I do this, and I do understand. I just don't have the supply to give to them right now.
Yep, it's a truthful and sometimes tough conversation, I'm sure. Staying on you, Dr. Dobson, somebody asks, how is the hospital's capacity right now? I remember way back in March of 2020, that was a major concern, especially with potential spikes as we see cases rise in Bennington County. How is the hospital doing with caseloads?
Yeah, you give me nightmares thinking about back in April and what we were planning for. So caseloads, so the cases are increasing. You can go on the Department of Health website and you see we're in the 40s in the state as far as hospitalizations, with about 10 in the ICUs typically. Again, hopefully that's leveled off a bit. Back in the summertime, we were in the single digits. SVMC would occasionally have 1 or 2. We're more now at SVMC having between 2 and 5 patients. It turns out that it's winter, so we also have lots of ski injuries. We have lots of other illnesses that cause people to be hospitalized. So our capacity is high, or I should say our hospitalizations are high right now. It's not COVID. We probably have 1 or 2 today. But just an increase of 1 skilled nursing facility or 1 location in our area would increase our hospitalizations. Let me just say one more time, that's why it's so important to get through these early age bands so we can keep those folks healthy and out of the hospital so that we can devote our resources to taking care of the community.
Great. Megan, how is the health department doing, especially Bennington County? I think some people may not recognize that you're based and located right there on right down in Bennington, downtown Bennington. How are you guys doing? How's the morale of the staff? It's been a long year, continues to be a long new year. How are you guys doing?
We're doing well. We're doing really well. We moved to what we're calling just our tier 1 functions about 2 to 3 months ago. It's pretty much 100% focused on the COVID response. We call them our buckets of work, and that includes the testing, which we were doing over at Bennington Rescue. We transitioned away from that a couple months ago, and SVHC has taken on that. We continue to offer facility-wide testing, so long-term care or congregate settings where there is a outbreak or potential situation. We're able to send staff in and do PCR testing there. We also have a team dedicated to outbreak prevention and response. And this is working with local schools, businesses, any kind of, if there was an event or a gathering, houses of worship, if there is a situation that arises with a potential COVID positive, we're able to work with the leadership at these organizations, identify any infection prevention practices that could be shored up, walk through isolation guidance, and just kind of being that assurance for folks that they can handle this and that you can get a situation under control and going forward, be prepared for anything that comes your way in the future. So, and then of course, now we have vaccine planning on our plate, but our team's been doing an excellent job. We've enjoyed the collaboration and the partnerships in the community, working with Dr. Dobson and his team, with Bennington Rescue, with our schools and local businesses. Everyone is just so eager to find out what they can do.
Yep, and we have a segment later on for young people who are going to wait a little bit, but the idea that you should be helping grandparents and neighbors who are older, may not understand the technology to hop online. So if you're looking for something to do, you're watching this, call those grandparents, those parents, people that may not be able to hop online. Question on Facebook, will online registration allow for option of home health injection, or should that be requested over the phone? Do we know that yet?
I'm not sure of that answer quite yet. We're hoping that is part of the registration call-in center, but more details to come. I wish I had more information about that. I think that's a really important topic.
Okay. Debbie asks on Facebook, Dr. Dobson, maybe we'll go to you first. Is second strain in our area? We know it's very close from New York. Does the first vaccine fight off the strain?
So I can say absolutely. The when you say the second strain, I think they're talking about different variant strains from different locations, and in particular the B117 strain. I can say absolutely it's here. I don't know that for a fact because we're not testing for it nationwide as much as people think. It's actually a laborious process. I read at one time 2 weeks ago only about 3,000 samples in the U.S. are tested for the different strains. I don't know if that has increased. It would be nice. I don't think we can devote the resources to it right now. I think we can just say it's here. We don't have a positive in Vermont. Then again, we're not testing as much. So it just means we have to continue with our mitigation and get through the spring. Lots of scary information coming out in the media about the rise of that variant and that it's more contagious, and those are all true. They will lead to more hospitalizations. But if we stick with what we've been doing, we should be able to get into this vaccination period okay.
And do we know in terms of the current vaccine that's out, does that help against these strains? And I think we talked a little bit about it a couple of weeks ago, but any new news on the current vaccine out by Pfizer and Moderna, and does that combat these strains?
Yeah, so far we're very assured that the vaccines that have been developed and approved are efficacious, the same actual effectiveness against that strain and probably other strains. Certainly some of the medication therapies could be inhibited. We're not using a lot of those medication therapies right now, so it's not so bad. At some point, mutations can outlast or outmaneuver vaccines. One reason we know that's unlikely right now is there's not that many people vaccinated. So you need to get the vaccine out there to start selecting for those mutations. I think Dr. Fauci pointed this out recently over the weekend. It's even another reason to get large percentages of people vaccinated quickly, because when you do that, the virus actually has less of a chance to mutate. So there's this sort of in-between phase that's worse. And so what we need is a large percentage vaccinated. I'm kind of, though, I know that people are listening saying, Yes, we agree with you. So why can't we all get vaccinated? And again, we're talking out of both sides of our mouth. The importance of getting it done, but not quite yet because we don't have the supply. But hopefully that will really increase at the end of February and into March as production scales. Plus, Matt, something we haven't talked about here in a long time, and that is the introduction of new vaccines later in the spring, which really may not right away, but by the summertime, improve our access to vaccine when we start getting into even younger age groups.
Great. Thank you, Dr. Dobson. This one may be for Megan, and then if, Doctor, you want to add to it, from Dorothy. When do you schedule the second dose? Is it not true that this two vaccines have different times for the second dose?
The two vaccines do have different timing for the second dose. Pfizer is a 21-day for dose 2. Moderna is 28 days. There is a little bit of wiggle room around those, but we really try to stress 21 and 28 days. Working within our clinic operations, we will actually schedule people for their second dose while we're waiting during that observation period. So folks will come in, they'll register, they'll receive their vaccine, and then as folks are waiting during that 15 minutes, we will get them set up for their second dose. So one-stop shop, and folks won't have to hopefully navigate the registration system one more time. They'll be able to do it right there as part of their appointment.
Okay, great. Thanks, Megan. This one may be over to you, Dr. Dobson. Is it possible that you can die a few weeks after the COVID vaccine after you get the second dose? I heard of a lot of people died after getting the COVID vaccine.
Yeah, so that's not true. There are people that have died after getting the second dose, just like there are people who didn't get the dose and died. And that's just life, and that there is a certain number that happens to. We're talking about, we have vaccinated in the world now over 25 million people. So some of those people have passed away by chance. Now, there is the report of the one individual in Florida who developed something a couple of weeks after the vaccine, and that's unlikely to be tied. But if it is related, it would be extremely rare, much more common to get COVID-19 and have some terrible effects, even for a young person. That's way more common. So it's hard because you see those stories in the media. And everyone's susceptible to this, including myself and any statistician. You start seeing things and thinking, but when you really look at it, it is so rare. It's like winning the lottery, except in the opposite way.
Yeah, and that's been a common theme of yours, Dr. Dobson. Every time we've done these, and just echoing what you said with kind of that thread of truth, which is, you are much more likely to get COVID, and you are much more likely to die or be very, very sick or get other people very sick. All these, whether the conspiracy theories or just fringe things that have happened are just fringe. They're just that, as opposed to this national and global pandemic, which we see the science and see the reality of that, of so many deaths. Yes, again, echoing what the health center and the health department have said time and time again, it is better to get the vaccine than to get COVID-19. A question from Cassandra: does the vaccine have amoxicillin in it?
It does not. The vaccine ingredients are available in many locations. We have them on our website. I'm sure the Vermont Department of Health has it, and certainly the CDC and the FDA. You can look at those ingredients right there.
Okay. Another one about dosage. Second dose, does it take 2 weeks to get into system? So maybe on top of that, Dr. Dobson, just talk about once you get the first dose, what that means for your immune system, the second dose, what that means, and how far out.
Sure. So when you get that first dose, it takes your body days to weeks to develop multiple different types of immune responses, not just the antibody response that we all hear about, but also other types of T cell and other B cell type responses, and that can take, again, days to weeks after that first vaccine. In fact, that's why people have trouble fighting off the virus and often get very sick or die, because their body just hasn't had time to develop the defense. And then, it's unknown how efficacious or effective just one dose of the vaccine is, but it's probably pretty high in its effectiveness. But once you get that second dose, then your body sees that. It goes through its first episode of making all of these antibodies as well as other white cell responses, and then it's what we call primed. So once you get that second dose, maybe up to 14 days later, we use that. It's very conservative. It's probably within a few days, but let's say 14 days after that second dose, then the next time your body sees true COVID-19, within hours, it has mounted an entire response, and you will never even know about it because it's just going to take the virus and make it, and render it harmless.
Okay, great. That's helpful. A woman called in the CAT TV. So from all different directions, we're getting questions today. She sees her doctors at Twin Rivers. Will she be able to get the vaccine there or over at SVMC?
The question really is, where does she live, Matt? So if she lives in Vermont, she certainly can get the vaccine here. If she lives in New York but works in Vermont, she can get the vaccine here. If she lives in New York and sees Twin Rivers, she needs to go through the New York mechanism for vaccination, which is different. I did hear that they are booked out for at least 6 weeks in the entire state. I don't know if that's true or not. I read it somewhere. And Twin Rivers has applied to be a vaccine site. I don't see that happening within the next several weeks. I think it'll be much further down the line.
Okay. I want to circle back around this idea of health risk, health conditions, HRHCs. Can you talk a little bit about that, either Dr. Dobson or Megan? And then when do younger patients with HRHC become eligible for vaccination?
Go ahead, Megan. I'll start off, and Megan can finish some of that. This is another one of those really compelling needs. We know that it's a majority of the patients that are hospitalized or succumb to the virus are elderly. The second group are those that are not elderly but have these what are called high-risk health conditions, including diabetes, obesity, some heart disease. And it's very compelling. Unfortunately, when we bring them out too early and try to start figuring out just who those people are, we run into these same operational problems. New Hampshire has moved forward, and some other states have moved forward. They're trying to identify those people. I can tell you it is causing a lot of problems. What Vermont is planning on doing, and of course this could change, but I think it's a pretty much defined now, is to get through the 75, 70, and 65. And then when we open up to the younger than 65, we also open up to these high-risk health conditions. And it will most likely not require verification by a doctor or a hospital or a health system, because that would be so laborious. It's most likely going to be self-assessment and honor system and truth. You'll be asked some questions. Do you have one of these diseases? And if you do, you can sign up. And that is, I want to tell you, I'm very pleased with that decision. The state is doing the right thing in getting it done this way.
Great. Anything to add, Megan, to that?
Yeah, right with Dr. Dobson, the prioritization can really impede moving forward. So it's great we're moving with the age bands and taking that approach. And Dr. Dobson, if I could bug you you shared a stat the last time we were together about the majority of high-risk medical conditions are, with our higher age bands, high majority of them. So really are, both of those factors are being covered at once.
That's right. Greater than 80% are in the 65 and above. So that wasn't an accidental choice, I'm certain, by the state.
Yes, we do know we have an aging population here in Vermont, both economically, but I'm sure, like you've mentioned in the past, Dr. Dobson, especially, just if we can focus on that 75 and above and even the 65 and above, that will take care of a lot of people in Vermont.
Yeah, in fact, 65 and above is a third of the state.
Yeah. question again to Megan. This is just popping up on Facebook, so I want to make sure we answered if we haven't already answered it. Where will there be a Department of Health clinic in Manchester? Has that location been decided yet, or will it be decided soon?
There will be a Manchester location. We are confirming those details today. So when we make the registration announcement, folks will see that location option come on board. Our plan is to be in the Manchester area 2 days a week for clinics.
And to expand on that, Matt, what we hope, what Megan and I hope and others hope is that we're using this online registration with the state. So if you happen to live in one location and you look and the clinic is filled, but it's not filled in the next location over, then you can do that. And that's what we want people to do. We want to load bear these sites. We don't want to reserve them for certain locations. We want them all to be filled. And the only way to do that is through central registration. And so we're very pleased that, that will go online soon.
Yes, I know we've done a couple COVID testing tests, and the system has been terrific. And it's worked that way where you can kind of see open seats, whether that's in Brattleboro, Bennington, Manchester. So that's going to be pretty exciting if we can continue on with that theme. Speaking a little bit into the future, maybe not too far into the future, there's a question around, will pharmacies eventually be vaccine sites? Can people just wait and get vaccinated at their local doctor's office? And not sure if we have to get through a first round first and then vaccines later on in life become just like that, the flu vaccine, or do we see that happening sooner than later?
Yeah, I'm going to start with that. The answer is yes. The pharmacies will get them, and it will be like flu vaccine, and you can get them at the pharmacy. You can probably get them at Walmart. You can get them at the doctor's office. Please do not wait. Please do not wait to get the vaccine at your doctor's office or somewhere you think of as being a little more convenient. Believe me, I want people to go to their doctor's office, their provider's office to get care. It's where they know, it's where they're familiar, but not in a pandemic, not when we're in this emergency situation. We need to get it into you as fast as possible. Every week that someone does not get vaccinated, their risk of COVID-19 is high, and we want to avoid that.
Great. Megan, this question's coming up again. So just to remind our viewers who might just be tuning in, homebound and can't get to a vaccine clinic, what can they do?
So hopefully more details will come out. The state is working on a plan to partner with home health agencies as well as EMS providers to set up a system so that folks can receive a vaccine in their home if there's mobility, transportation, a reason that seemed fit. But more details to come. But it is a high priority item. As folks know, transportation is one of the biggest barriers folks face. So we want to make it as easy as possible.
Great. This one comes from Facebook. We'll start with Dr. Dobson with this one. While so many COVID positive people are asymptomatic, why is screening for fever, cough, etc. the standard for accessing services like school attendance, hair salons, dental offices? Not sure if there's an answer to that one, but thought I'd throw that out to you, Dr. Dobson, first.
Sure. So I would say that I think the person is saying, does this add value in doing this? And it's a great question, and there is argument that it does not add value. I can say that initially it was very important as we were trying to understand this virus, how it spreads, how people develop symptoms towards it. I'll say I agree, it probably does not add near the value it used to, and I imagine it will wane in its prevalence, just like hopefully the virus does after vaccination.
Yeah, and is that even true? I often think even today, after our first initial conversations, just about the amount of wiping down in Germ-X, and I'm always kind of just thinking in the back of my mind, this is great for flu season. This is great for a healthy community, and let's continue with it. But not sure that the excessive wiping down that we've seen at our gyms and whatnot is really preventing COVID-19 at all.
Probably not, Matt. You've heard me say many times that that's not how the virus is spreading. It's spreading respiratory. On the flip, it's possible that it's not spreading as much that way because we are wiping down and we're not touching each other. And so perhaps if we started doing that again, we would see the shift a little bit. It's still predominantly respiratory. There are other reasons to wipe down equipment besides COVID-19. So one benefit here, if there is any benefit, it's not really, is to say that hopefully masks in healthcare settings and potentially some other locations will stay for a few years and help decrease other viruses from being transmitted, and that wiping down things will help with some bacterial diseases that that cause GI problems, for example, that all this wiping down is going to decrease those.
Yeah, and I think you mentioned before, Dr. Dobson, and we go back to some of the five that you always talk about, but really the social distancing is still necessary. I think you mentioned on the last call, even as you have the vaccine now, you have lower tolerance as well as you go continually out there, and a lot of people don't have the vaccine. That having the vaccine doesn't make you immortal yet, and social distancing is still necessary.
That's absolutely correct. However, I do have to change something, Matt. I'm not changing my message, but I want to emphasize, if you do get vaccinated, and lots of people get vaccinated, you will be able to hug people again. You will be able to come close to them again. And unfortunately, we've kind of focused too much on get the vaccine, but you still have to do all these things. Well, there is an end there. It just requires that more than a couple of us are vaccinated. It requires that, majority of us are vaccinated. And once, as we're approaching that, and you've got groups of friends and everyone's vaccinated, not yet, but pretty soon you'll be able to gather with them because it will be safe. And if we can get a large percentage of people vaccinated by, midsummer, then we can return to a lot of these activities. So right now we have to do this, but we have something to look forward to. And frankly, I have to have something to look forward to keep me motivated. So this is a good one.
Yep. Absolutely.
Absolutely.
Megan, we'll start with you with a question from Carl, but Dr. Dobson can weigh in as well. Carl asks, what is the expected weekly delivery of vaccine from the federal government over the next 4 weeks? Should it increase or does it remain at 8,800? And what is Bennington County's allowance?
It's a good question. I'm not sure about Bennington County's specific allowance. There are different allocations for going forward for the health department, for hospitals, for eventually pharmacies, long-term care. So there's different allocations within the allocation. Right now, we've heard it's pretty steady at the 8,000, 8,800. I think folks were really optimistic that at this point we'd see 12,000, 13,000 coming in a week, and it's just slower. Just as we've been stressing for this panel, that supply is everything. So right now, we're anticipating for the next couple of weeks, looking at kind of this consistent 8,000 to 9,000.
Yep. This one for you, Dr. Dobson. What is your position? Maybe not your position. Where are we at with vaccinating pregnant and lactating women?
Right. So, start by saying there were not a population of pregnant or lactating women in the trials. So that's why that there's not a recommendation that or a clearance in that regard. I can tell you there is a strong recommendation, and you asked about my personal on this. It's strongly recommended that pregnant people and lactating people do get vaccinated. And let me just tell you why. I have to say this again, but COVID-19 kills. It will cause miscarriages. It will cause all kinds of problems in people, and the vaccine does not. So, just because there's not a study on this specific vaccine right now, there is a study, and there are multiple experiences that show that the tremendous problems that people who are pregnant will have if they get COVID-19. And if you think you can just avoid it, I think that's super. I think you should try, but your chances of getting it, are just too high. People that they are going through mitigation, that are doing their best, still can get the virus, and that would be devastating to a pregnancy.
Okay, great, good words. When will those under 16 become eligible for a vaccine? Megan?
Yeah, it's a tough one. So right now there are trials going on. They started as early as November, I believe, for children. Some are 12 and above, some are younger than that. And it will be nice to get some trials with the kids in. I had hoped it would be before the fall, before we would get that data. We may not have that data by the fall. It may be more into the fall and winter of next year, which is unfortunate in that regard. I'll say that it is very likely that once we get the data, we can move quickly with those age groups, much more quickly than we're moving now at this time, because we should have plenty of vaccine. We should have vaccine alternatives, or excuse me, additional vaccines, and the ability to get them vaccinated more quickly.
Should I get the vaccine if I have already had COVID-19? I think we talked about this last time, Dr. Dobson, but again, for the audience, talk to us even about what, I think you did a great job last time talking about the antibodies that are formed because you've had COVID-19 versus this kind of synthetic vaccine, which kind of gives you superpowers when it comes against fighting COVID-19. So talk to us, one, about if I've had COVID, do I need a vaccine, and why I need a vaccine?
Sure. So you do need the vaccine. And the reason is because people that are exposed to the actual virus may or may not mount a large immune response that is sufficient. And we see this with all kinds of diseases, whether it's chickenpox or others. Most people do mount a solid immune response, but sometimes if they only see a little bit of the virus or something else is going on, they may not, and so they're insufficiently protected. We know that if you've been exposed to COVID-19, if you've come down with COVID-19, or you have tested positive for the SARS-CoV-2 virus, that you've most likely got good immunity for at least 90 days. And frankly, it's going to be longer than that when we find out, but we say 90 days. So when you hear people say you need to get vaccinated, even if you've had COVID-19, but wait 90 days, the reason behind that is simply supply. Same theme. If we had plenty of supply, we'd say, nope, go ahead and get vaccinated. But if you're within 90 days, it's better to let someone else get that vaccine because you've got a good immune response until that point, and then you can get vaccinated.
Okay, Megan, over to you, and then back to Dr. Dobson. What if somebody has received their first dose and then gets sick or is exposed to COVID-19? Do they have to start all over again? Have there even been cases where people get their first dose and then get sick, and then, as the question asks, do you have to start all over again?
From my understanding, you do not have to start the series over again. Dr. Dobson, I might lean on you for this one.
Sure. Yeah, absolutely. No, you don't need to start over again. You wait till you're healthy. We say this magic number of 14 days since your symptoms developed, and then you go ahead and get that second dose. And frankly, if that dose is 40, 50, 60 days out from that first one, it's totally fine. This is how boosters work. We encourage and want people to get vaccinated right at that 21 or 28 day, as Megan started, and there's reasons for that. It certainly can't be earlier than that. We be concerned about how effective the vaccine is, but later than that, it'll be just as effective. So if you develop sickness, and by the way, someone said, has that happened? Oh yeah, it's already happened here. We've had people call and cancel because they got the first dose and then they turned positive because they were exposed. And so they wait until 14 days and they get the second dose.
Great. I want to remind our viewers, if you're still watching on Facebook as we wrap up, if you do have some final questions for Dr. Dobson with Southwestern Vermont Medical Center or Megan Harrington with the Department of Health in Vermont, please put them in the comments. We will try and get to them. We'll stay on for a little bit longer as we get through the last bout of questions, but if you have something that you really want answered, please put it in the comments. One question that came through was, if you've received the vaccination and you've had your second dose, are you now able to travel without quarantining upon return?
Those policies have not changed as of yet. We are still operating as we are, and it will probably be some time before those are adjusted. Our rates are good. We're doing a good job of getting folks in, but we still have a ways to go before I think those policies are changed.
Yeah, and I can say, Matt, that that's exactly right. You will see that some states have already gone ahead and made that change, New Hampshire being one. The quarantine requirement is dropped if you're vaccinated 14 days after your second vaccine. The reason that we're unlikely to do that so quickly is it really does set up inequality. And there's still some questions we need answering. And like we said last time, and Megan was sort of alluding to this now, but as we said last time, if you are vaccinated and those around you are not vaccinated, you still have I'll call it a decent risk of contracting the illness. So traveling around and not quarantining is not appropriate.
Great. Recently, you've expanded testing hours. Can you describe why it is important to continue to test as we roll out this vaccine? Maybe start with you, Dr. Dobson, on that one.
Oh gosh, yeah, same reason. If you test positive, you're going to spread it to others. And if you test positive and you go quarantine, then you won't spread it to others. So it's pure math. It's like, let's keep the transmission down.
Okay.
We've seen that, just some props out to our community as we're doing our outbreak prevention and response work. It's very heartening to reach out to an organization and to hear that they've already launched into their isolation and they've identified close contacts, and people know the drill. So, but testing is what allows people to know their status and make those calls and keep people home. So, but a big applaud out to our community for just kind of knowing what to do.
Right. And on that theme, Megan, what kind of younger generation who's kind of waiting and they have to get through a multiple age bands to get to them, what can they be doing to help both the department and SVMC? What can we, those under the age of really 40, be doing to help? And we alluded to this a little bit earlier with our technical savvy and being able to help an older generation hop on. What are some things we can do?
Absolutely, keep up those preventative measures, the mask wearing, not visiting with other households. We talked a little bit about supporting folks who are isolating, within your own age group or our older friends and family, picking up groceries or picking up medications, standing in the front yard and waving, whatever we can do to support people in that decision, I think is wonderful. We do have some opportunities if folks are interested in helping with our vaccine clinics. We do have a group called the Medical Reserve Corps. This is for health professionals who are interested in helping. You can sign up and actually help either within our vaccine clinics. So any kind of medical background, chiropractor, dentists, physicians, surgeons, we've got veterinarians, we've got a little bit of everyone on our MRC team. So if you are interested in getting involved in that way, there's lots of opportunities there.
Great. As we wrap up, let's do a little recap here. Where can people register, and what are some of the websites and phone numbers people can call as they start to register? And remind us of that date again, Megan, as well.
Sure. So January 25th, if not a little before, the call center number as well as the URL where folks can register will be posted. And again, that's going to be splattered everywhere, I would imagine. So keep on the lookout for that. We're encouraging people to register online if they're able. If not, the call center will be available for folks. Like I said, we brought on about 200 people to help folks get registered. If you have challenges with internet access, that service is available. And I forgot the rest of your question.
Just what's the age range that we're starting with?
Oh, it's 75 plus.
So 75 and plus for the foreseeable future, the next couple weeks.
Yeah, absolutely.
Okay. And Dr. Dobson, remind us again who can register. Who can register if they're watching this and they're looking to register in Vermont? Who's eligible?
Right. So, and another good website resource, we talked about the Department of Health's just website resource. It's really good. And then svhealthcare.org has lots of information. And of course, will be, as Megan said, it's splattered across the page as soon as that registration site is open. You can be vaccinated in Vermont in your particular age band. So right now, again, that's 75 and above starting on the 27th. If you are a resident of Vermont, and by that meaning you've lived here for at least 6 months out of the year, or you have recently moved here but intend to stay, or you work in Vermont, so perhaps you live in Massachusetts or New York and you work in Vermont, or you live outside of Vermont but you come to Vermont to see a primary care physician or provider. Those are the groups of people that can receive the vaccine here in Vermont. We want to vaccinate everyone, no matter where they're from, but we can't do that right now because the allocations are set up in a way based on your population. So at some point when the supplies are high, just like you can get a flu vaccine in another state if you wanted to, that'll be the case with the COVID-19 vaccine as well.
Great. Well, I want to thank both you, Megan, from the Department of Health, and Dr. Dobson, as always, joining us. And those watching, we've tried to do these every couple of weeks. I'm sure we will have another one coming up. So if this was informative for you and gave you just even a little bit more comfort being able to talk to our local experts, we plan to be back with more of these. Please tune in. Please tell your friends. And as you hear those questions and they're being answered, please bring them back to us. And we hope that you join us again. I want to thank again Dr. Dobson and Megan. Thank you guys so much for hopping on today and just calming some of our fears as we go into, hopefully, and sounds like a very bright future with a lot of vaccines on the way.
Thank you so much.
Thank you, Matt. And just to say, as we sign off here, for people to understand the next few weeks, be patient with it. There's the systems are going to be overwhelmed initially, and the supply is going to be low. We will get to that steady state. Just keep at it. Keep the faith.
Great. On behalf of the Southwestern Vermont Chamber of Commerce, Southwestern Vermont Medical Center, and CAT TV, thank you everybody for tuning in, and be safe the rest of the week.
Thank you.